Okay, so today we are gonna cover the new Homer 3 and we have our guest speaker, Dr. Meryem Yücel. I would like first, before introducing our speaker, just like some reminders. So you are all muted. Questions are welcome at any time. There's a panel in the GoToWebinar where you can write your questions. We will focus on answering during the webinar, answering questions related to the tool. Other questions we will address later on, or you can also review our first webinar regarding the installation and the first use of the toolbox. We also already have on our website the last webinar that we did. And of course, this webinar will also be available in our website after the series, and all questions will be also answered. Okay, so we welcome today Dr. Meryem Yücel. She's a research assistant professor at the Neurophotonics Center at Boston University. As all of you know already, she's an active contributor in the field of fNIRS. She has developed and advanced fNIRS data analysis techniques, especially with the Homer 2 and 3 toolboxes. She directed and performed various fNIRS human studies imagings at the MGH and Harvard Medical School, as well as the Boston University. And also in her research includes the assessment of pain during surgery and monitoring patients with epilepsy. Her current research interest is a span of functional neuroimaging in cognitive neuroscience. I would like then to welcome Dr. Meryem Yücel.
Okay, thanks a lot, Maria. Hi, everyone. It's nice to have you here, although I cannot see most of you. I hope you're safe wherever you are. So here is my talk.
Yeah.
Okay. So instead of putting a title, I put my outline as a title. So I will start with motion artifact correction methods, and most of this talk will be on motion artifact correction algorithms. And then I will give a brief introduction to Homer 3, and then we will move on with MATLAB and open up Homer 3 and use the motion artifact correction algorithms. I will show in a bit with Homer 3. And then at the end, if we have time, I will go on and talk about a little bit on our new method, TCC-AGLM, that we have recently published. Okay. So fNIRS allows measurement in relatively unconstrained environments. Could be a hyperscanning study where 2 or more people interact. Could be a real world study where you have the cap on, walk outside. I know you can go to grocery and still have your measurements. And it's also applicable to populations where such measurements are difficult or not possible with the state-of-the-art imaging techniques such as fMRI. Infants, kids with autism, or long-term measurements in intensive care units. These are a few examples. These are all great, but it also means your signal is susceptible to motion artifacts. Here is an example of how the motion artifact contaminated signal can look like. You can see there are some physiological oscillations. Do you see my mouse? Oh no, maybe.
Yes, we do.
You do?
Yes,
okay.
Yes.
Okay. So we have, we have spikes, as you can see here or here in the signal, and you can see some physiological oscillations here, much smaller than these large motion artifacts. So how do these occur? Majority of the time, this is due to the optode scalp decoupling. Each source or detector, we call an optode, it's crucial to keep scalp optode contacts for the proper light piping. If an optode moves and quickly comes back to its original location, generally this ends up creating a spike in the data as we see here. If the optode ends up on a different location on the scalp, this would mean a change or a permanent change in the signal intensity, and so will appear as a baseline shift in the signal. We have a baseline shift here, like the signal was going like this, and then there is this baseline shift and also a spike, but then the signal did not come back to its original level. So this is an example of that. And also large and slow head movements can also create pressure-related slow change in the signal. The best practice is, of course, avoid the motion artifacts in the first place. This can be achieved by properly securing the cap on the head. And one way to do is to literally glue the optodes on the scalp, which we have done previously at MGH. We use the glue called collodion. That's regularly used to fix EEG electrodes on scalp in epilepsy monitoring units. However, even if you have taken all the measures, you can still end up having motion artifacts in your signal. For instance, imagine you secure the cap, but then the subject can move their eyebrows, and then the whole skin will move, and it will still create a motion artifact. Okay. So there are various ways of identifying motion artifacts in the literature. And this figure is from a paper we published in 2018 that shows different types of motion artifacts, spikes, baseline shifts, and slow motions. I have also already shown that in the previous slide, but here this is a spike. The red ones are spikes. Baseline shifts are shown in green, so there's a change in the level of the signal, and there are slow drifts, which are much difficult to detect, by the way. So we have these different types of motions, and in this paper, we also show that the detection way may change depending on the type of the motion. For example, some detection parameters may not capture fast spikes as well as slow motions at the same time. Or ideal correction methods also be different for spikes and baseline shifts. So that's what we have investigated in this paper, and we came up with a hybrid method, and I'll show you when we are doing it. We are trying different algorithms on homework 3. As I mentioned before, the best practice is to avoid motion artifacts in the first place. Years ago, we had this project that we wanted to measure patients in epilepsy monitoring units for long periods of time, like up to a week. Of course, it will be quite challenging to obtain a good signal with conventional solutions. So we built these special fiber ends with glass prism, and we tried out these fibers on the scalp. And actually, our first test subject was David. Here you see David. And we were able to get good signals even during motion. He was walking, and we were looking at the screen, and the signal change was quite robust to motion. This process is regularly done to glue EEG electrodes on the head at MGH. So we followed up that. And on a follow-up study, we systematically compared the signal quality of fNIRS channels using glue-on fibers versus Velcro-based fibers, because at the time we were using Velcro-based fibers. Right now we are using EEZ caps. So on one subject, for instance, on the one hemisphere, we glue on fibers, and on the other hemisphere, we put on a Velcro-based fiber or probe. And this figure is showing a raw signal on 2 channels, one collodion fixed, which is this red channel here, and then one from the Velcro probe, which is this green line. And we asked subjects to do different motions, nodding up, down, or talking, or shaking their hands, etc. And overall, we observed a great reduction in motion artifact-induced signal chains, and also 3 to 6 times increase in signal-to-noise ratio. And here on the right, we show the signal change due to each different type of motion artifact. So Here, for instance, RL is, moving head to right and left. This is like nodding up and down, etc., like talking. And so on each of these different movements, we observed a different amount of change in the signal. Interestingly, raising eyebrows resulted in the highest signal change because, as I mentioned before, it moves the skull. But glue-on still worked well here. You can see the results from glue-on fibers. So there are some measures, or rather advancements on the hardware side as well, that can also naturally result in the reduction of motion artifacts. So now we see more and more small and light devices, fiberless systems, and accelerometers directly attached to the system itself. Conventional heavy fibers can also contribute to the motion artifacts because the subject basically carries all these fibers on his head or her head. And these new systems, they're LED-based, and LED-based sources can be directly placed on the scalp, and then so can reduce this motion artifact-related contamination. And as I said, we see more and more of these mobile systems which keep getting lighter and so more robust to motion artifacts. So we have done everything we can do, but at the end of the day, we still ended up having motion artifacts. So what do? We have some remedies we can apply to the signal to detect and correct them. We basically have two options after we identify the motion artifacts in the signal. We can exclude the motion artifact contaminated trials from our analysis, or if it's resting data, we can remove those parts of the signal. And this could be a method of choice if you have only a few trials contaminated, but many more clean trials still remaining in your data. But how about if you have only a few trials and most of them are contaminated? So you don't want to lose all of your trials, then there is no information left in the signal. Then you can choose to correct them instead. There are various ways described in the literature on how to do that. One can broadly divide these options into two. Methods requiring external recordings, such as an accelerometer or a reference NIRs channel. And there are various methods on how to use them to correct for motion. Here we listed a couple of them: linear regression, adaptive filtering, or binary filtering, and TCA GLM. But not everyone have these external measurements. Then we can use the temporal or frequency characteristics of the fNIRS signal itself to correct for motions. So in this talk, I'll mainly focus on these. So here I show them in green. So these 5 different motion correction methods, I will mostly focus on them. But also at the end of my talk, I plan to mention our latest work, which uses temporally embedded canonical correlation analysis to create regressors from, for instance, an accelerometer, and then uses it in a GLM as a regressor to correct the motion directly within the GLM. So first step in motion identification, the motion identification is the first step, right? One can, of course, go through all channels and visually inspect the motion artifacts. But first of all, this is quite cumbersome. Some of you have already known. And most importantly, also, it's very subjective. Homer has functions that perform an objective detection, which are based on simple criteria and a couple of parameters. What we do is we typically look at change in optical density. For instance, if the optical density change within a certain time period, for instance, 1 second, is greater than a certain amplitude, then we define it as a motion artifact. that time, the signal in that time period. And generally we look for rapid change that are much faster than physiological changes. For instance, they're much faster than heartbeat or other oscillations in the signal. We can look at either absolute change in amplitude or relative to the standard deviation of the signal. They can both work. The screenshot you see is from Homer. When you run this motion detection function in Homer, it will create red patches around the detected motion artifact, as you can see here and elsewhere. So after detection, we can either remove the trials that are contaminated by motion artifacts, or if we have limited number of trials, as we said before, we can proceed with a motion correction algorithm. We have a function in Homer 3 for stimulus rejection. It's HMR underscore stim rejection. You see here in green. And it has a user input parameter T range, which defines the time range within which, if there is a motion artifact, the stimulus will be rejected. So Homer also allows manual rejection of trials, but this function is doing it automatically and based on objective motion detection criteria. So what I mean by this, so we have this T range parameter, for instance, assume it's from -2 to 10. So your stimulus is always at time 0. And this function, stim rejection function, looks at the signal change within this time period from -2 to 10. And if it finds a motion artifact there, it will reject the trial at time equals 0. Basically, that's what it is doing. So here, so we have this signal, orange and green, 2 different channels, fNIRS channels. And we have these huge motion artifacts. It's like large spike here and like small ones elsewhere. And when we apply stim rejection function, and if we put T range 0 to 0, it will show the motion detected signal. I mean, you can see the motion artifacts here again in red patches, but there is no trial. So each of these blue is a start of a different stimulus. So none of them are excluded, except this one, because the motion artifact is actually on top of the stimulus start. So like time equals 0 is here, and then we have a motion artifact here, and so it's excluded. If you look at here, now we changed time range from -2 to 20. We have the same motion artifacts, of course. And now much more trials are rejected. So now what it's looking at is, so time equals 0 here. It looks at 2 seconds before and 20 seconds after. And of course, we have this huge motion artifact here. And so it excluded this trial, and is similar with the rest of the trials. So of course, how you define this parameter is, if you expect your HRF to go from 0 to 15, maybe you want to include that much in your T range. Okay. So just a note on motion rejection. In block averaging or in GLM approach, these trials that are rejected by this function are not included in averaging in Homer. So in block averaging, this means you simply do not include it in averaging. That those trials are just not included when you average all the blocks. But in GLM, this also means, of course, these trials are not included, but also it means the data in red, which were like the motion contaminated part of the signal, they are not also modeled. Just give a note. Okay, so how about if you want to correct for the motion? we can apply various techniques presented in the literature. Here, as I mentioned before, I'll talk about a couple of them that we also have in Homer3 that you can go ahead and try yourselves as well. So the first one is introduced by Felix Schoppmann. So in this motion detection or motion correction method, again, the first step is to, again, identify the motions. The red patch here, rest looks clean with the intact heartbeat signal. So we have this motion artifact, and the rest of the signal you see like nice heartbeat. Let's zoom in. So this is our motion artifact. We zoomed in the motion artifact. And what spline correction does is it fits a polynomial into this motion artifact, seen as the blue curve here. Next step is to subtract the fit or the model signal from the original signal, and the magenta is showing the corrected signal. Now you can put the signal back into the data, but you see now we have an offset here, or a baseline shift when we put it back to the original signal. And so the next and final step is to do an offset correction. Here we corrected for this offset, and then now the signal level is the same before and after the motion correction. So this method is really good at baseline shift corrections, those type of motion artifacts. Just to summarize, it's a simple, fast approach, corrects only motion artifact segments, and corrects signal offsets. What is the limitation? Requires a reliable technique to identify motion artifact segments. So with spline, you have to have a motion detection function before it, and I'll show it with Homer3. And for instance, if that detection algorithm doesn't detect most of the motions, of course, spline cannot do anything. So you have to go back and check your signal, and if those red patches are at the right location, and whether you're missing any important motion artifact or not. So you have to make sure that detection is doing its job so that spline can do its job as well. Okay, so the next method I want to talk about is principal component analysis. This is introduced by Dr. Zhang. So we have these n number of measurements. What PCA does is to first dissect this data into n orthogonal components in descending order of variance. Thus, the first component explains the most amount of variance of data, and the last, for instance, the least. So it's in descending order of variance. So the second step is to remove m number of these components. Typically, first couple of them will be enough in a NIRs signal, but it of course depends on how much motion artifact you have in the signal. One can also remove a percentage of variance. That's, for instance, you want to remove 90% of variance, and PCA will remove as many components as it takes to remove that much of variance from your signal. And both options are available in Homer3, like percent or number of PCA components. The third step is to reconstruct the signal with the remaining principal components. And this study by Teresa Wilcox is with 6-month-old babies. And for this age group, actually, the dominant source of variance is typically motion artifacts. And I'll show you a data set here, and you'll understand what I mean. So in the study, babies are watching a visual display. I mean, you see here, and marked here as these red patches. So here they are watching the display, and then here the rest periods in between. And in these rest periods between visual display, they start to move their head, of course, and in the signal we see these giant motion artifacts. They move their heads, probably we don't see here, but so this creates a lot of motion in the signal. Here a PCA filtering is applied to the signal. Only the first component, principal component is removed, and you can see the reduction in motion artifacts, but it's still there. So it's not as large as this here, but it's still there. And here, first two principal components are removed, and the artifacts are much more reduced. Here, if you look at this blue line versus this and this, we have a much reduced motion artifact. But something else is also happening here. Not sure if you have noticed. If you look at the hemodynamic change, for instance, here, look at this last, let's focus on this last block, this hemodynamic response versus the one on the third one here, after removal of two components. So it also reduced the brain activation related signal. As of course, because brain activation is also responsible for a certain part of the variance in the signal. But this is of course not something we want, right? We want to keep the brain activation, but remove the artifacts at the same time. And especially in adults, since the main source of variance may not be motion artifacts as much as like in infants, this method may not be ideal. Yeah, so it's just repeating, but summarizing, very efficient when motion is the main source of variance. Limitations, it requires multiple channels and assumes that the motion is the dominant source of variance, and this may not hold for all studies or all groups, and it tends to remove too much of the activation signal in adults. Okay. So we came up with a simple solution to this. Instead of applying PCA to the whole data, why not apply it only to the parts of the data that are contaminated by motion? Then we know for sure that the dominant source of variance is motion artifacts. So we detect motion contaminated parts of the signal. There again, the red patches here, and then concatenate them and apply PCA. And only on this part of the data set, not the whole part of the data set. And then we can remove either m number of principal components or a percentage of variance from this part of the signal, and then we put the signal back into the original data. And this may also create offsets, and we correct for them. And now our data looks better. Okay. So again, summarizing advantages and disadvantages. Advantage is PCA is applied only to pre-identified motion artifact segments to avoid overcorrection. And limitations, it requires multiple channels, same as PCA. Okay. Yet another algorithm is wavelet correction. This is introduced by Dr. Molavi and Dumont. So we have our original signal again. It is NIRs heartbeat, but also motion artifacts, spikes, and these like slow changes in the signal. This is our original signal. Here, one would first decompose the signal into its wavelet components. Now we are in a frequency time domain. The assumption is that when you have these wavelets, the wavelet coefficients will have a normal distribution, and the outliers will be due to motion artifacts. And we typically define these outliers in terms of interquartile range times a constant. And this constant may change depending on the motion artifact amount in your signal. You may want to play with it. And there are some numbers in the literature for infants versus in adults. And these coefficients in these regions, as I said, like beyond the interquartile range times a constant are assumed as outliers. So we remove the outliers or set coefficients of the outliers to 0. Sorry, going back. And then what we do is we then recompose the signal back by an inverse wavelet transformation, and it nicely corrects for spikes, but not the offsets in the signal. You see, like this spike is corrected, but there's this baseline shift. So this motion artifact actually consists of both a baseline shift. Here, the signal level is here, and then it goes here. But there's also a spike. Spike is perfectly corrected, but there is still like this change, this offset that is not corrected. So it's really good in spikes, but maybe not that much in baseline shifts. So here is the reconstructed signal. Closer look. Again, summarizing advantages, better at maintaining frequency content. This is really good, especially if you're doing resting state like connectivity analysis and such. The frequency component is really important. It keeps cardiac respiration and such nicely. Limitations, as we said, does not correct signal offsets. Slower than other approach. This is, I mean, this can be, of course, this can change in the future, but right now it's kind of computationally demanding. So it takes a couple of minutes, depending on your data set, to run this, compared to a couple of seconds with other methods. Outlier parameters varies with studies and populations, generally lower threshold for infants than adults. So you have to also take that into account. Sometimes, depending on the value you use, you can also overcorrect, like remove the brain activation itself as well. Okay. So another motion correction method is correlation-based signal improvement. So it has two major assumptions. So sorry, it was introduced by Dr. Kui. So going back to assumptions, the first assumption is that oxy and deoxyhemoglobin are negatively correlated during functional activation and become more positively correlated when a motion artifact occurs. And the second assumption is that motion artifact induced signal is uncorrelated to true physiological signal. So let's look at these figures. This will explain it much better. So here you see in red and in blue oxy and deoxyhemoglobin signal. And here on the bottom in black, what we see is running correlation. So it's looking at the correlation between these signal and its change in time. So if you look at it, the correlation is typically -1 or at least negative, almost all the time throughout this whole time series. What they did here is, so by the way, sorry, I didn't mention that, but these pink vertical bars represent the stimulus onset for a finger tapping test. And in this first one, they were keeping their head still. But in the second one, so they also add a small head motion. And now, as you can see, the running correlation now it's going towards the positive. Like, so this is 0, and now we have these positive values. And they also did an experiment where they had large head motions as well as finger tapping. So if you look at here, the correlation now, it's almost always positive. This is the 0 line, and during the task, it goes up always in the positive range. So this method actually forces oxy and deoxy to be negatively correlated and recreates the true signal by this. So advantages, it's a simple method and enables online correction and shows good performance when motion artifacts occur simultaneously to stimulus onsets. And this disadvantage is basically these assumptions. So it makes assumption on HRF response, which might not always hold. So especially like if you're looking at a different population, right? For instance, a patient group. So you don't know if their physiology has changed from what is typically expected, that is oxy and deoxy going in different directions. Maybe because of the abnormal physiology, now they are going in the same direction. We don't know that. And also we don't know this holds for all the tasks we will be doing in our experiments. And we also don't know whether it holds in developmental stages, like for infants. We don't know if they're always like in two different directions. So if you force them, so then it will be like creating a data or making up a data. So so that assumption is something that one needs to be careful about. It can also it can also introduce artifacts in the HRF itself. Okay, so just I think I have 2 more slides on the motion artifact part. Why we care about correcting for motion artifacts? Of course, we know it by now. It can reduce the number of usable stimulus onsets, and also can introduce spurious effect in hemodynamic response recovery. Imagine you have a speech study, so right after the onset, the subject starts to talk and like says a sentence. So it just doing that, of course, will create brain activation in language areas, but also it will create a motion artifact in your signal. So they will be like locked. They will be happening at the same time. So it will be much difficult to really extract the brain signal from motion related chains in your signal. Motion artifacts can also introduce artificial difference between 2 groups which are prone to motion artifacts differently. It's not something like one will think about, like, but it's something that needs to be considered as well. It's interesting because we have seen it in one of our studies. So this is an example of comparing healthy versus clinical population, and the clinical population here is a stroke patient group. This is work by Dr. Juliet Selp. So she looked at interhemispheric correlation in a healthy group as well as a stroke patient group, and it's in low frequency bands, and she found a huge statistically significant difference between the 2 groups. But then she also looked at the motion artifact segments in those 2 groups. This is just the number of motion artifact segments in healthy and stroke population, and she saw that there is significant difference. So actually what we were seeing as a interhemispheric correlation, and we could easily, go ahead and drive many neuroscientific conclusions from that, but it was just because of the different motion artifact content in the signal. So Juliet did something interesting. So she took the motion artifacts or those parts of the signal from stroke patients and literally add them to healthy subject data, and then did her analysis. And this is without any correction or removal. Here you see, so now this cyan one is healthy plus motion artifact. And now actually we lost the significance in difference between hemispheric correlation. And then finally what she did is she totally removed those parts of the signal. Healthy didn't have it in the beginning, but she also removed the parts from the stroke patients, and then she compared the two signals. That now you can imagine these are two clean signals, and then she saw a difference, and now we can call it a true difference in physiology between these two patient groups. So this is something to be careful about, not something that will come to a mind like right away, but it will be good to take that into consideration if you're comparing two different populations. It can also be like infants versus a group that will have less or more motions, right? Or elderly. It can also change with age group. Okay. So so this question comes up a lot, and I don't know if you're also asking it today, but I will be answering or maybe not answering right now. So what's the best method, right? We want the best method. We don't want to worry about all these different methods. Best method depends on the type of motion artifact and how much it exists, right? So we saw with the PCA work that it works well in infants, because in infants the principle, like the main source of motion is or a variance is motion artifacts. And there is this study by Rob Cooper, and in his study he compared different methods and actually like using a synthetic href, like adding a synthetic href and checking how well it can be captured by after cleaning with different types of motion corrections. And he found that wavelet and spline were most effective in that study basically. And I mentioned this, but in our TPCA study, we also compared, of course, our method with different types of methods in the literature. Again, this is like a conventional way of how you can compare it. You add a synthetic href, you correct with TPCA, you correct with wavelet, you correct with spline or different methods, and then you estimate the href and you look at this href, the estimated href versus the true href, because you know the true href. You can look at literally the difference between the two. That's mean squared error. And you can also look at the correlation, like how the temporal characteristics change. So that's just a side note that's the way you can compare different methods. But yeah, in that study, we saw that TCA was doing good. Sabrina Brigadai, she also did a study, but not with synthetic href, but now she had this data set. It was a real speech study. You recall, like this is like a tricky data set because you have your motions that motion artifacts appear right after your stimulus starts. So that's kind of a tricky data set. And she found that wavelet, excuse me, wavelet and CBSI were most effective in this data set. And finally, in the study that I just mentioned from Julia Selb, this was a resting state data, and the most effective way was actually discarding the motion artifacts sequence. So overall, of course, I said it like a couple of times during my talk, but if you have enough trials, if you have only a few trials that are, motion artifact contaminated, just remove them, just discard them and use the rest. You don't have to do any motion correction. But if it's like 1/3 of your data or 2/3 of your data, you of course want to correct for that, because then there is nothing useful in the data set. Then you can use any of these methods. They shouldn't give too much different results. If they do, there's something wrong with the parameters chosen, or I don't know how the method applied, but they shouldn't give two different results. Okay, so now I'm gonna go switch.
Sorry,
Yeah.
Dr. Rita. We would like maybe to give a break. We have some questions on the motion artifact part. Maybe we should just answer a little bit before going to the next one. Is that okay for you?
Yeah, sure.
Great. If you wanna, you can open your camera.
Yeah.
So we have received some of the questions here. I will answer. I will ask first of them, and yeah, we will just, all of us will ask some questions. So first of all, thank you very much. So you have already received a lot of thank you for the lecture.
You're welcome.
So we received some questions about the resting state. So should we expect also this negative correlation between oxy and deoxy during the resting states, or only during functional activations?
I would say yes. I would expect, yeah, HPO and HPR to be in different directions for resting state as well.
Okay. Milen, would you like to ask the other one?
Yes. Would you recommend using a different type of motion artifact algorithms for event task, block task, and resting state? And further question, which according to you would be the best one to use for adult population during resting state?
Okay, the best one. I already got the question. I kind of tend to wavelet if it's the resting, and like adult event. I don't think there is much difference between event or block. You can use. I don't see, at least now, there's a reason to choose different algorithms for event versus block. So we published not recently, but in 2018, a hybrid method. I can recommend that, and I'm going to show it when I do the correction. I didn't mention it in my slides because it's just a combination of two of them. It's a combination of spline interpolation and a filtering method. We tested that and compared it with different methods. I can recommend it, but I'm saying like any of these methods are fine. I don't think they will get like two different results anyway. I think you should be fine. I just want to mention that I know it's really hard work, but it's always good to go back and look at your signal, your original signal, the motion artifacts before and after the correction, if they're like if it's doing an overcorrection, if it's smoothing too much, or if it's not correcting at all. It's always good to check with whatever methods you're using.
Thank you very much. And we will take one more question, and that will come from Lamia.
Yes, first of all, thank you so much for this last slide. I mean, the whole talk is fantastic, but the last slide is a lot of compact usefulness. And you summarized very well. I'm sure you receive those questions very often, so that's why. But you summarized very well, like, okay, how, like, what is the best method depending on the application, depending on the type of subject and data. And my question is actually when. So we receive this question very often. Some algorithms, not only motion correction algorithms, but also, for example, short channel regression, some algorithms are applied to raw data, some algorithms are applied to optical density, and some are applied to already converted hemoglobin. And we never really understood why. So what is the best approach, and does it depend on the type of algorithm that you're applying?
Yeah, it's a good question, and yeah, we get that question a lot as well. So the Homer functions, except the CBSI, they're all applied on optical density data, not the raw signal. Just the default parameters are for optical density, not for the raw intensity. You can also do that as well, but now it's all set for optical density. So one thing is, if you're doing a filtering, bandpass filtering, we want the correction before the filtering. So you just have this intensity to optical density change, and then you have your correction, motion correction, and then you do the filtering. Because if you do the filtering, sometimes it has this huge motion, it smooths it, like spreads it to the whole data set. So you don't want that. Yeah, it's typically before bandpass and after intensity optical density change. But CBSI, it's applied on concentration just because it's looking at oxy and deoxy correlation.
Okay, thank you.
You're welcome.